Hi, it's Tom here from Running Physio. Today I want to talk to you about when you should suspect a stress fracture in runners that you're looking after and athletes in general that you might be seeing in clinic. I've also included a link to our free webinars all about various different running injuries. So if you'd like to learn more about managing running injuries in general, do check those out. So in this video, we're going to talk about 4 key areas when we're suspecting stress fractures. So we're going to talk about history, signs and symptoms, at-risk patients, and also the importance of trusting your gut when it comes to suspecting stress fractures. So let's start off with the history component of this. Now, this is quite important, and obviously with any athlete, you need to take a thorough history to give yourself a good idea of what the likely diagnosis is and the potential causes, including taking a good training history. And this is particularly important in stress fractures because really you're not going to get a stress fracture sat on the sofa. You're going to expect to see a reasonable level of training that's happened there, and that this training may well have changed recently. So has there been an increase in the training volume perhaps, or the training intensity or training frequency? And we think fatigue is a component as well to the development of bone stress injuries. So has this increase in training volume led to increases in fatigue levels and perhaps reductions in recovery? So you're going to have a little bit of suspicion if there's been a high level of training and if that training has changed. If, however, the training is relatively low and seems to be manageable, perhaps at a lower level than the athlete's used to, I'd be a little bit less concerned and perhaps a little bit less suspicious of a stress fracture. Although, as with every aspect, we're going to look at the whole picture really. Whole picture is important. Also, recovery is a big part of this, and there's some evidence to show that sleep is particularly important for bone health, and lack of sleep may well be a risk factor for the development of stress fractures. So if you have someone who isn't sleeping very well or isn't recovering very well, particularly if that's combined with high training volume or high training intensity, that would put them at a greater risk of developing a stress fracture. There is also some evidence from studies like Nussbaumer's work that stress may play a role. And we know actually that with recovery, it's recovery not just from the physical aspect of training, but from the emotional stresses that are placed on us. So if you have someone with a high training load, they're very stressed, they're not recovering well physically and emotionally, that's going to put them at a higher risk of developing a stress fracture. Although, of course, fair to say that's going to place them at higher risk of a number of different running injuries potentially. So history important, looking at training and how it's changed, and recovery too. And we've worked with a great physio, Scott, who actually developed a sacral bone stress injury, a sacral stress fracture, not because his training had changed an awful lot, it hadn't, but because his sleep had dramatically reduced after having a baby. So in that situation, it may be the lack of recovery that was more key for his stress fracture than the training overall. Okay, next up we want to think about signs and symptoms, key signs and symptoms that would wave a little flag and make us think stress fracture. Now, one for me is weight-bearing pain. Pain during walking, weight-bearing and impact would, for me, make me suspicious of a bone stress injury or a stress fracture, particularly if someone's really struggling to walk, they're ending up walking with a limp and they're getting discomfort during doing that. If you are working with someone and you want to test this in clinic, you might find that perhaps they are comfortable with walking, but you may want to do some impact testing, starting with light impact like jogging on the spot before progressing on to more challenging impact like jumping, bounding or hopping. And this can be a quite good way of assessing if there's impact pain. And if there is impact pain over a bony region, again, that's going to add weight to this idea that it may be a stress fracture. Also, how pain behaves will give you some clues. Now, we see in tendinopathy this warm-up effect. As you keep going, sometimes the pain from the tendon actually reduces and feels more comfortable. But we don't tend to see that in bone stress injury very often. We have what I would call a crescendo pain. So the pain continues to increase with increasing activity and with increasing impact. So if you're getting that pain that develops during a run or during impact and gets worse and worse, that would be a little bit more typical of a stress fracture potentially. Other signs and symptoms that are important: night pain is important. This is a recognized part of bone stress injuries and stress fractures. Swelling can be a feature too, particularly in more superficial bone stress injuries. For example, anterior tibia, you may be more likely to see bruising and swelling. With some deeper bone stress injuries like a femoral neck stress fracture, much less likely to be able to visualize that. So of course we have to bear in mind the location of the possible bone stress injury for the signs and symptoms we expect to see. Bony tenderness, again, will be something that I would look out for. And again, much easier with your more superficial structures. For the tibia, for example, I would palpate very thoroughly along the tibia, feel along the medial border, which is where you might expect to see medial tibial stress syndrome, and also along the anterior tibia as well. Because if there's anterior tibial tenderness, particularly if it's a focal point, that's much more consistent with a stress fracture. Whereas if the symptoms are spread along the surface of the medial border of the bone, that's more consistent with medial tibial stress syndrome. So those focal symptoms that are there on bony palpation, again, another key sign for stress fractures. There is also some evidence that symptoms may be more severe in bone stress injuries and stress fractures. For example, Nussbaum et al.'s work found that 81% of athletes with a bone stress injury had a pain score of 6 or more out of 10. So these findings, if you're seeing night pain, swelling, bony tenderness, weight bearing or impact pain and more severe symptoms, really this should be setting alarm bells off for you to be considering further investigations here. The other thing, and this can sometimes throw us off the scent a little bit, is clinically you sometimes find that tests of range of movement, of strength, our tendinopathy tests, our special tests for the joints and ligaments, etc., are all clear. They're not pain provoking. And this can sometimes make us feel like it's unlikely to be anything serious. But actually, I would look at that the other way around. If these tests are coming back fine, it's starting to reduce your options down. If you're not getting any pain when you're testing the joints, the ligaments, the tendons, etc., for me it makes it more likely that it's a bone stress injury, not less. So if those are coming back clear, if you're getting those other signs and symptoms that I've talked about, we should be strongly suspicious of a bone stress injury, potentially a stress fracture. So we've talked a bit about history, key signs and symptoms here. The next up is to think about at-risk patients. Now, patients that are in this group, I would have a raised suspicion of bone stress injury and stress fracture. I'd be more likely then to go on to arrange further investigations. So this includes female athletes, particularly younger women, seem to be at a greater risk of stress fracture. And a previous history of stress fracture is a strong predictor of future stress fracture. So if someone has had previous bone stress injuries and stress fractures, again, that should raise your suspicion. Low BMI is a risk factor for stress fractures, as is suboptimal nutrition. So if someone has dietary restrictions or you suspect isn't taking enough energy on for the demands of their sport and day-to-day life, that can actually affect bone health and therefore can be a risk factor. There may be other signs and symptoms you would look out for there. For example, menstrual irregularities, again, can be a sign that there may not be adequate energy intake, and this can be a factor in bone stress injury development. Past medical history is important too, particularly past bone problems like osteoporosis, osteomyelitis. Drug history such as taking steroids and some medications like anticonvulsants, again, can supposedly increase your risk. And even things like pregnancy. Post-pregnancy is a time where we may see an elevated risk for stress fractures because you can have post-pregnancy osteoporotic changes, but you have this perfect storm in post-pregnancy where people are often sleep deprived and stressed. They're trying to get back into exercise potentially when they haven't done it for quite a long period of time, and this can then lead to bone stress injuries and stress fractures. So anybody in these at-risk groups, particularly younger women with low BMI and previous stress fractures, I would have a raised suspicion. And if in doubt, really, get it checked out. And I think an important thing to recognize is that x-rays are not great at identifying stress fractures. The gold standard is an MRI, particularly if you suspect a high-risk stress fracture, like a navicular stress fracture or an anterior tibial stress fracture or a femoral neck stress fracture. If you're suspicious, get it checked out, get an MRI as soon as you're able to, really, because that is going to be the gold standard. And the reason why we're going to do that, because it does actually shape management. In these high-risk stress fractures, they'll often be asked to be non-weight bearing or use a protective boot for a period of time, and we'll really need to stop people doing their impact and their sport to let things settle. Okay, so final point on this, and we've talked about history, looking at training load and recovery. We've talked about some of these key signs and symptoms like night pain, focal bony pain, impact and weight-bearing symptoms. We talked about at-risk patients as well. The last point I'm going to make here is to trust your gut with these things. If it just doesn't sit right, if it just doesn't fit the picture that's been painted elsewhere, perhaps, maybe they've got a diagnosis from elsewhere and you're concerned, I think that can be enough sometimes for us to say, okay, look, I want to get these tests done. Let's rule out this stress fracture to allow us to progress on with our treatment plan here. Let's not wait 6, 7, 8 weeks down the line to discover actually we're looking at a high risk bone stress injury and we need to be managing it differently. And just to give you an example of this, because it's not an easy concept, this idea of trusting your gut. A few years ago, we saw a 17-year-old girl with what had been diagnosed as plantar fasciitis. And for me, immediately, you're sort of thinking, well, a 17-year-old with true plantar fasciitis would be a little bit unusual. We normally see that in the older demographics. In her past medical history, she'd had childhood osteomyelitis, and it just didn't sit right for us. And so we arranged an MRI, and it did show a navicular stress fracture, which would be perhaps a little bit more of a likely thing than true plantar fasciitis in a 17-year-old with a previous history of bone problems with osteomyelitis. So if you're not sure, trust your gut, get those investigations done, and then that can guide further treatment. Okay, so a few thoughts there on when to suspect a stress fracture. As I say, if in doubt, get it checked out, particularly in those at-risk patients. Thanks everyone for listening. Please put your comments, your questions afterwards. I'll look forward to getting to those. We've also got the link I've mentioned to you there to our free webinar series, includes lateral hip pain, low back pain in athletes. You can access those straight away and enjoy those. And I look forward to speaking to you again soon. Okay, bye for now.